Hey everyone, hi, I'm Harith Iskander and I'm here at the Picaso Hospital. With me on Go With The Flow, because that's the name of the show, on my right, Robert, Datuk Robert, and also Doc. Is it Doc or Professor Farm? Should I call it Doc, Professor? Like big guy, big dude, big man, Doc Cukup, huh?
Cukup.
So Doc Farm and Robert, thank you so much. So yeah, so once again, did I get the pronunciation correct? Benign Prostatic Hyperplasia.
Traditionally, it's called benign prostatic hyperplasia.
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 Okay.
But this is a diagnostic or this is a pathological term. Actually, a more layman or clinical term, we can call it benign prostatic enlargement. More easier to be understand, right?
Okay, maybe easier to understand, but I still don't know what it is.
Something is big.
Something is big. Please tell me, what is big?
The prostate is big.
Okay.
These three words, benign prostatic enlargement. Benign means this is not something cancerous. Okay, it won't kill, so it's benign. So prostate is an organ. It's an organ located in our pelvic. Between is at the bladder. Below the outlet of the bladder is the connection between the bladder and the urethra. So it's like the exit of the urine from the bladder. Okay, like the pintu keluar. So that organ situated there. So enlargement means this organ getting bigger and bigger, right? So
there you go. You got it, the technical term. So correct me if I'm wrong. This is something that is dangerous, and am I right in saying it more affects men who are slightly older, perhaps in their late 40s or 50s? Is that a course of nature? Is that what not naturally happens?
It's only men have a prostate. That's why only affect a man. And the enlargement is a natural process. Means it's not like if you get ill, some cell or some organs go wrong. No, it's like your hair. You grow hair every day. Your hair getting longer and longer. Same thing to prostate.
Not everyone's hair. Not everyone's hair gets longer and longer. I just want to clarify that. Okay. Carry on.
So prostate enlargement is the aging process. It happens in every man. It's getting bigger and bigger. And one, because when it's getting bigger, it blocks the outlet of the bladder. That's why then when that time the urine flow out will have problem. So most of the time when the prostate start getting bigger, and the man should feel, have some difficulty to pass urine, or the urine come out very slow, all these symptoms will start happen. And usually it start after 50. About 10 or 20% of the men after 50 will have these kind of symptoms. And when you're getting older, the chances to get all these symptoms is higher and worse.
Okay, let me ask you. So the symptoms are urinating more and dribbling. So what? If it happens as a man, I go, so what? I'm just getting old. It's natural. Is there any negative impact?
No,
so what?
Course.
What happens?
Let Datuk share his experience. Why not?
Okay, so Dr. Robert, you had benign. I forgot already.
Prostatic.
BPH.
Right.
BPH. So in your case, your personal experience, what started happening?
Yeah, I used to urine very frequently. I found out that Professor Dr. Pham is one of the top BPH practitioners in Malaysia. So I went to see him.
But okay, let me just stop you there. So you start to urine frequently, but are you aware that this is not a good condition to have, or why did you suddenly decide to go and see a urologist?
If you have a car, you have to maintain it, So similarly, your own body, if you notice some problems, it's not normal. So go to the doctor. And
so basically your Porsche down there was not
functioning
or functioning
too frequently.
That's
In
fact, too frequently it was releasing black oil. So to speak lah. something like that.
Like yellow oil.
Yellow oil.
Let me add out something. Datuk Robert come to see me in a very early stage. So some of the patients, they come quite late. Just like Harith, you say, so what? You know, I still can pass urine, so what? Yeah, it happened in a lot of men in Malaysia or Asian. As long as the urine can come out, they won't see doctor. Even some of the patients, the urine don't come out also, they don't see doctor.
So let me just ask you, if a person is going through these symptoms in their late 40s or 50s, and they don't go and see a urologist like yourself, what could possibly happen?
Okay, come. They usually start with slow urine flow. The urine usually in a young time, you can shoot up. Now you flow up, and you know you need to stand quite long in the toilet to just wait for the urine to come out. Or the urine is, we call intermittency, come out a bit, then stop. Then you squeeze a bit, come out a bit. So this is all the symptom of early BPH. And if you don't bother about that, the flow will getting worse and worse and worse. The time to pass out the urine getting longer and longer and longer. And come to one day, we just cannot pass urine.
So this is
fully
considered
blocked.
prostate cancer? Is that
No,
what
no. The enlargement big is we're getting bigger and bigger until it blocked the outlet, everything blocked. So the urine stay in the bladder and cannot come out. Means that pintu sudah tutup. The door is closed up.
It's like that scene in Titanic when the doors close and the water coming like Jack.
So there is a time you need to come emergency to the hospital, and we need to put in a catheter for you.
Okay. So that is the extreme case. So just if you're not gonna watch any more after this, if this is happening to you, quickly go and see your urologist. But what are the steps? An elder gentleman like myself, okay, so I'm meeting my age here. What are the steps we should take? What are the precautions? Like Robert, so what did you do?
Okay, first thing, of course, to consult a specialist. Read as much as possible, you know, and then
You went through this experience.
Oh yeah.
Okay.
You know, for me, it was more of frequent urinating at night, so it was disturbing my sleep.
It was disturbing your sleep.
Yeah.
So you were waking up many times during the night.
Yeah, and so I consulted Dr. Pham.
Okay, can I just ask you a question? Because I think as a man, was there some kind of like macho, like, should I talk to someone about it? Should I discuss with someone about it? Because I know as a man, sometimes we think, Allah, it's nothing, I can handle it. It's no big deal. We're afraid to discuss it with someone. We're afraid to get information. We're afraid to meet someone about it. In your case, did that happen?
Oh no, because you know we even shared in my chat group with my classmates, asking them, hey, any of you all have this problem? And after that, I shared my experience with them. Prostate is well known, BPH, but many people, you know, don't want to address the issue. It's always postponing it to another day, you know, and that's when the problem starts.
I take it that you consulted with a urologist at an early stage.
I maintain my car very well.
You maintain your car. Always going back to the car. This is how we cover line. So you're something wrong with your car, you heard the tuck sign. Straight away you went to see the mechanic of the barang down there.
Don't wait until the car jam on the road.
Don't wait until the piston block.
Don't wait until the piston block. Now that one all the men can understand. Now you know what you're talking about here. So fortunately, Robert went to you at an early stage. So what are the steps? If you go at an early stage, what do you do? What can you take? How do you stop or prevent or slow it down or eradicate it?
From the very beginning, the early stage of investigation, usually, you know, we will check the uroflow. We have a machine. Then the man will pee on the machine. Then we have the graph, you know, like the ECG graph. So we can read the graph and know this is slow, this is fast, this is, you know, this obstructed, non-obstructed.
Oh, it tests the
flow.
But you know, like Malaysians, sometimes I go toilets, I don't know why Malaysians, they shoot, they shoot all over the place. This machine can...
Harith, the thing is, men always like the big boy, you see, or not, we will say, you need to aim on that. The more precise is it, you are the better man. So they will happy.
Challenge them you give them a bullseye.
You want the bullseye.
Smart, are you? Okay.
So this is one thing. Then we will usually do the ultrasound, and also we will usually check the PSA, the prostate specific antigen. Usually after 50, we will check on the man for the risk of cancer. That is for the risk of cancer. Okay. We hardly will poke the man anymore nowadays. Usually we don't do it.
So in Robert's case, did he come in at a fairly early stage? And then what treatment did you go
So
through?
usually we will start the medication for him, the tablet to relax the prostate and, to get the flow out better. Okay? So this is why I start with him first.
And did it work
No,
for
it
you?
didn't work.
At first
It didn't work on me. Yeah,
Okay.
the pill. I mean, the pill was firstly first step. If it doesn't help, then you go for the procedure.
What procedure?
So there is few intervention which I have introduced to Robert, which the most traditional one is TURP, transurethral resection of prostate. Okay, which is we put a scope camera through the penis meatus, the hole. Okay, but it's all under J. Okay, patient sleep, patient won't feel. So we go all the way in, and we will use the electric knife to resect the enlarged part to unblock the channel. Okay.
You went through all this?
No, he didn't.
My heart already stopped already.
So another option when the time he had problem, resume just introduced to Malaysia. I'm thinking it's about 2-3 years ago, right?
You did this thing called Resume. So, Doc, what is Resume? What is it?
I would rather say this is water vapor therapy for the prostate, which is a pretty new technology in treating prostatic enlargement problem. So how we do it is still we need to insert the camera into the urine hole all the way to the prostate. Then from there, when we see the prostate, instead of resecting like we do the therapy, this one we don't need to resect. We just put in the needle into the prostate and we will inject the water vapor into the prostate. Then the water vapor will do the job, will do all the work to slowly steam off the prostate tissue, and the tissue will flow out through the urine. What is the benefit? First, it's very fast. It just take about 5 minutes, 10 minutes.
Oh, so you don't have to stay overnight in the hospital?
No, it's
and
a
all
day
that?
procedure.
Okay.
And even some of the high-risk patients, heart problem, they don't need to be under GA. They just need to go through some sedation. Sedation means we just make the patient a bit fainter, they make them a bit blurred, then we can do it. But definitely under monitoring by the anesthetic around to see the heartbeat, ECG, And another thing is the risk of bleeding, risk of infection is very, very, very low as compared to other conventional surgical treatment of prostate.
All right. I got it. That is the treatment. So, Robert, in your life personally, so before and after, maybe you can share a bit like before, what were the difficulties? And now that you have sort of taken care of it, how does it free you up?
But before that, I like to re-emphasize the reason why I choose, this water vapor therapy is because there was no incision. That saved a lot of headache. Not incisive. So it saved a lot of risk, like what Doc Farm said, bleeding. And internally, you won't be able to see it,
So
and
did it work for you?
Oh, yes.
Okay.
It worked very well. And after that, the urine flow was very good. Of course, I had some obstacles where, I couldn't urine. So I had Dr. Farmer to put the catheter back again. But it's just for another 2 weeks,
The problem of water vapor therapy is after the treatment, you need to put at least with the urinary catheter for 1 week. Okay? But some of them need 2 weeks or 3 weeks, and Robert need 3 weeks. So
everyone is different? Depending on the stage?
I would say no. So far we unable to have any predicted factors for those how long the patient going to be on catheter. Even the prostate size is not an predicted factor for that. 80% of the patient 1 week. So about 20, about the other will be 2 weeks and 3 weeks. But so far my longest patient is 3 weeks. Right.
Maybe I could add there, when I went to shopping mall after the treatment, about 1 week later, when I urine, I noticed a small stone came out. So I quickly went back to Dr. Farm and explained to him my situation. So what they did is he did another check and found out there was another stone there. So that stone could have been the cause of the problem why I had to...
Was this a kidney stone or what?
Maybe it's a kidney soon come down actually. His kidney soon come down.
At the end of the day, the whole point of this conversation is just to bring some awareness. Fast forward, Are you back to so-called normal now with this? That you, number one, you identified it. You went for consultation. You went for treatment. Now, how?
I mean,
Everything
basically, you feel relief.
Relief. So you don't wake up multiple times in the middle of
Not
the night?
not so often. And the most important, your urine flow is good.
Okay.
You don't have difficulty.
Yeah. You're married?
Yeah.
Your relationship with your wife, did you speak to her about this? Was she as
We
concerned
just
about you?
tell them, I mean, as usual, everybody will be worried, myself included, But it's something which you got to bite the bullet.
I'm sure he's doing well because he didn't come to follow up for a long time.
Oh.
I need to call you, Datuk. A long time you didn't come to my clinic.
Yes, as usual,
Doctor to cari makan only. Why you don't come see me? I got no bill to give you.
No, I called him for the interview actually.
Okay, so at the end of the day, if there's one message I can take away, because I'm listening to this as New Year's as well, it's if you're a gentleman, if you're a man in your late 40s, 50s, and yes, and even myself, I go through those occasions when the urinating period takes longer, it begins to become more frequent. At the end of the day, even if you think something wrong or you don't think something wrong, it will make sense to go see your urologist just to check things out. Am I right?
And one thing never forget is after 50, regularly check the PSA as well. This one of the
PSA?
mistake. Yeah, the prostate specific antigen. Because after 50, all the men have the risk to develop prostate cancers. And also we want to pick up prostate cancer in early stage. So the only symptoms in prostate cancer is raised PSA. There's no any physical symptoms, you won't feel anything about prostate cancer in early stage. The only symptom, raised PSA.
This I actually do know about because I've done some studies myself. There are no symptoms, but you do need to go for a blood test and ask for the PSA element in it.
Right.
So at the end of the day, if your minimum is your 50, just go and do it because at the end of the day, there are no symptoms. Is that right?
No symptoms.
There's no symptoms, but something could be wrong.
Then the symptoms, usually the urine symptom is from this benign prostatic enlargement. It's a benign thing. It's not a cancerous thing.
There you go.
Right.
It's benign. It's not cancerous. But
Cancerous is silent.
The cancer is silent. All right. Is there anything else you'd like to add before we wrap this up?
So just one more advice for the audience out there. Nike says just do it, but I say just do it now. Don't postpone it. Thank you.
I'm going to copyright what Datuk Robert has just said. Just do it now. Nike, I got it. And Doc Pham, any final words?
Never be embarrassed to see a urologist whenever you have any urination symptoms. Just come to us. We'll give you the right advice.
So just to wrap up, if you're around 50 or 50 and above, please go and do a blood test and check out the PSA. And you can also go to the website, which is myprostatehealth.my, which in this website, there's the IPSS test. So, Doc Pham, what is this IPSS?
IPSS is the International Prostatic Symptomatic Score, which you can self-assess you whether you are, you have problem with this prostatic enlargement problem. In this questionnaire, they will have few symptoms that they give you marks, which is something like frequent urine. So 1, 2, 3, 4, 5. So you will place yourself. 1 means with totally no problem. 5 is very severe, and same thing like slow urine flow. Your flow is very fast, then it's 1. Very slow is 5. So you will have few parameters. Then after that, you will add up all the score. Then in the website also, they're going to tell you your total score will place you in which group, the severe group, the intermediate group, or just a very early stage group. Okay? At least you can know something about yourself.
Yeah, there's a small problem with the tests like that because in school, I fail all my tests. Even when I test myself, I fail. So I guess I don't even have to test myself. I'm going to fail. Of course, I'm just joking. But thank you so much. Thanks, Doc, and thanks, Datuk Robert. Really appreciate your time. Everyone out there, we appreciate the time for watching this. This is Go With The Flow. Hope that you've learned something. I definitely have learned something. And continue to look after your own self, look after your own health, look after yourself like you would look after a car. All right? Take care. Thank you very much.
Thank you.
Thank you.